I wanted to narrate this before and after because even though it's a simple filler for the upper and lower eyelids, it may be a little bit confusing when you're looking at it. For the lower eyelids, I think it's pretty obvious that there is an improvement in terms of the hollowness there. The upper eyelid is something that I came up with in early 2015, and I've published in a couple journals, in Plastic Reconstructive Surgery Journal, and in actually a colleague's book recently, as well as a JAMA Facial Plastic Surgery. The concept here, if you see this woman, and the top photo, it is in 2014, and the after photos in 2016, after a couple treatments of fillers, is that I filled the inner brow. So if you look at the area that's toward the nose and the inner upper eyelid portion, you can see that it is empty on the before image. And on the after image, you can see that it is now fuller. Why is that so important? The reason for that is that it horizontalizes the eye. If you look at the top photo, and she's a young lady at 30 years of age, it's starting to look sagging. And if you look at the brow, it actually hasn't been elevated, but it's been filled in. And by filling the inner brow as well as the outer brow, but focusing on the inner brow, you actually drop the inner brow, and so that the slant of the outer brow that looks sagging is now been modified. And so this is something really cool that works, as you see, in someone who's 30 years old, as well as someone at 80 years old. And it's a good way to cheat if you're not quite ready to do a upper eyelid procedure, or even if you are, I oftentimes combine this with this kind of treatment. By the way that I do this is using micro-disposable cannulas. A cannula is a blunt device that allows me to sculpt the eyelid in a way that is extremely safe, minimal pain, less bruising, very fast and accurate. And I really believe this is the gold standard. It's how I do all my fillers around the eyes. And unfortunately, I think over 90% of physicians don't use cannulas on a consistent basis. And in my opinion, it's unfortunate. I've been doing this since October 2010, and I highly advocate the use of cannulas for safe periorbital or fillers around the eyes.